Hi, my name is Samantha Smith. I'm a student here at the College of Nursing. Today I'm going to be demonstrating a heparin injection. So first I'm going to show my space. There's no one here with me. I'm going to show I have my medical administration record, my chart here, all my stuff for my patient room, my syringes to select from, my medications to select from, and I am prepared. So for starters, I just want to verify that I am in a no interruption zone. It's important according to hospital policy. Next, I'm going to start verifying that my MAR and my chart match and there's no discrepancies. So I'm first checking that I have the right patient here, Jaguar Jones, medical record number 4176352. 4176352 in the MAR, date of birth 8/25/1963, date of birth 8/25/1963. We have the right patient, everything matches. Now I'm going to check the right medication, heparin in the chart, heparin in the MAR, the right dose, 5,000 units subcutaneously, 5,000 units and 5,000 units in the MAR. Then subcutaneously is the route, and subcutaneously is in the MAR as well. They match. The time is every 12 hours. The time is every 12 hours. Those match as well. I'm also going to assess the allergies. He's allergic to penicillin in the chart, allergic to penicillin in the medical record, the medication administration record. So everything matches. The indication is not listed, but the indication for heparin is to prevent blood clots in immobile patients, or any patients, to prevent blood clots. And we see here that he has an motor vehicle accident. He might not be the most mobile, so this is appropriate for preventing blood clots in this patient. So now that we've checked everything, there's no discrepancies, we're going to move on to the medication administration record. And we're just going to be using this for the rest of the evening. So I'm going to do some quick hand hygiene. And I'm going to perform my first route of the 7 rights of medication. So I'm going to check his name and make sure we have the right patient here. Jaguar Jones, medical record number 4176352, date of birth 8/25/1963. I want to get the right medication, so I have heparin here. I'm selecting the right medication. Heparin, 10,000 units per milliliter. I have heparin here, 10,000 units per milliliter. The medication is in date. It expires December of next year, 12/5/2025. So that is good. Next, I want to make sure I have the right route. It is subcutaneously, so I'm going to select the correct needle and syringe, which is a tuberculin syringe. Here it is. And I want to make sure I have the right dose. So we need 5,000 units. I have heparin 10,000 units per milliliter. So I know I need half a milliliter for this. To be 5,000 units according to this. So I'm going to first start out by cleaning my medication vial. I'm going to start in the center, do circular motion outwards, not going over the same place twice. And then while that's drying, I'm going to take out my tuberculin syringe, draw up half a milliliter of air. Alright, so now that I have half a milliliter of air, I'm going to inject this half a milliliter of air into this clean vial. I'm going to draw up slowly half a milliliter of solution. We want to avoid getting any bubbles. We want to avoid contaminating the plunger. We can draw up extra solution if we need to, so that we can tap out these bubbles. Let's tapping out all the bubbles. Okay. Alright, I have half a milliliter of solution, no bubbles. I'm going to scoop, sorry, here, I'll put it over here so you can see what I'm doing. I'm going to scoop the needle back in to recap it. I'm not actually touching it, so what I'm doing is I'm using the vial to actually re-scoop this needle so that I don't actually have to touch anything. Now that it's on, secure it, everything is good. Now I'm double checking. I have 1/2 milliliter of solution. I need 1/2 milliliter of solution to get that 5,000 units in the chart because I have 10,000 units per milliliter in my vial. So I'm going to show you this. I have 5 milliliters of solution, no bubbles. All right, that looks good. So now we've got the right dose. We're going to check the right route subcutaneously. I have the right needle for the right route every 12 hours. He has not had this medication in the past 12 hours, so that is good. The right indication, which is to prevent blood clots, and then the right documentation, nothing is missing for a legal prescription, so that is great. Everything is good. I'm going to make my label here. I'm going to include the medication name, the dose, and the patient's name. So the medication name is heparin, 5,000 units, and I have 0.5 milliliters. And it's for Mr. Jaguar Jones. All right, make sure you write it clearly so that you can read it. Make sure when you put it back on your syringe that you are not covering up the amount of medication in your vial. All right, so we have that good to go. We're going to perform our second check of the 7 rights. So first we're going to start with making sure you have the right patient, Jaguar Jones, medical record number 417-6352, date of birth 8/25/1963. We're going to make sure we have the right medication, heparin. We see it in the MAR, heparin. I have the vial here, heparin, and I have my medication syringe, heparin. We want 5,000 units for the right dose. We have 10,000 units per milliliter in this vial, so we need 1/2 milliliter. We're going to double check that we actually have 1/2 milliliter in this vial, and we'll actually have a second nurse double check if that is necessary. And we do have 1/2 milliliter. Our label is correct. Subcutaneously, we have the correct needle for that, for the right route, every 12 hours for the right time. And he has not had this medication in the past 12 hours, so he is good to go. And the right indication to prevent blood clots, right documentation, everything here is documented correctly, nothing is missing. Same for my needle, my syringe, I want to make sure that's labeled correctly too. So now that I've got everything good to go, I feel confident going into my patient room. I personally want to double check his allergies, penicillin, know that going into the room. So I'm going to get my alcohol prep pad because I know I need that going into the room. I'm going to knock. I'm going to enter. Hi, Mr. Jones. I'm going to raise your bed up to a good working height. Well, first I'm going to hand hygiene. Then I'm going to raise your bed up to a good working height. I'm going to put on some gloves, some clean gloves. And I'm going to check your armband to see if it matches with, we're going to perform those 7 rights all over again. So we're going to double check we have the right patient here. Mr. Jaguar Jones, Jaguar Jones in the MAR, medical record number 417-6352, medical record number 417-6352, date of birth 8/25/1963, date of birth 8/25/1963. So we have the right patient. We already see his armband says he's allergic to penicillin. His allergies in the MAR say he's allergic to penicillin. Are you allergic to anything other than penicillin? I would ask the patient. So no, we're good to go. So that brings us to, we have the right patient. We need to find the right medication. So we're going to check with our vial and our syringe. So in the chart it says the right medication is heparin. Vial, we have heparin. And in our syringe we have heparin. We need 5,000 units for the right dose. We have 10,000 units per milliliter in the vial, so we need 1/2 milliliter. We have 1/2 milliliter still. We want to double check the amount in our syringe, make sure our label is correct. And also when you're checking the right patient, it's good to check, your syringe and make sure it says the right patient name because you have it on everything. So that matches too. The right route subcutaneously, I have my injection pad. I'll explain the subcutaneous route in just a minute. The right time, every 12 hours. He has not had it in the past 12 hours, so that is great. The right indication to prevent blood clots, and the right documentation. Everything is documented correctly. Nothing is missing for illegal documentation. Perfect. So I'm confident that everything's good. I've already checked his allergies. Right patient, right medication, right dose, right route, right time, right indication, and right documentation. So I feel pretty confident. I'm going to select my injection site. I'm going to go based off of what is already in the record. I don't want to, for regular like routine injections subcutaneously, I don't want to go in the same injection site. I want to rotate injection sites. So I'm going to pick the abdomen because it's easy to rotate there. For the abdominal subcutaneous injections, we're not going to want to go above the costal margins. We're not going to want to go below the pubic area. And we're not going to want to go laterally past the anterior superior iliac spines, laterally. So that gives us a 2-inch border around the umbilicus that we can inject into. And again, we're going to want to rotate injection sites. So for this, we are going to want to clean our patient. And to properly clean, we want to start in the center, move in a circular motion outwards, not going over the same spot twice, don't want to contaminate. And then we are going to pinch. And for this injection, we are going to want to go in a, we can pinch an inch here, so I'm going to go in at a 45-degree angle. Quickly insert, inject over 30 seconds for this heparin injection, keeping it pinched. And this needle will go immediately into the sharps. And our lid will go into the sharps. We're going to want to go ahead and cover that back up, release it. We're going to want to lower our patient's bedside back down from that working height. We're going to want to put that side rail back up to keep them safe and in there. And we are also going to want to document. We're going to want to document our location that we chose. We're going to document our patient's response if it was a pain medication, but this is just heparin. And since this is heparin, we are going to want to reassess our patient, make sure the medication is working effectively. So we're going to want to assess for any signs of like warmth, redness in the legs, any signs of a clot later on afterwards. And continue to monitor our patient. He's safe, he's lowered, he's comfortable. Our sharps are immediately in the sharps container. Our injection site looks good. So that is everything. I want to thank my patient. Everything is documented correctly. Yeah, thank you so much.